Hi, Sharon.
Hi, Dr. Yu.
It's 2019, November 8. You have been come to our clinic for 15 months.
Right.
And we give you Chinese medicine, acupuncture. Your vision has great progress. Can you share with us what have you seen in the past 15 months? What's the progress?
Okay, so when I first came, I had some visual field down on the bottom, but very little up here. It was very narrow.
About
12
15 degrees.
Yes, yeah.
Mhm.
And I think I told you, I know I talked to some other patients about it. When I closed my eyes or when I dreamed, I couldn't see more than just this little circle of what I saw
Yeah.
when I was awake. And now that is like a big screen. And but when my first perception, I didn't think this worked, and when I first came, I didn't think it could possibly work. But if you remember, after about 3 days, I saw something out in the right field where I hadn't seen something in over 20 years, and I cried. But it was very shadowy at first, and to begin with, it seemed like somebody just turned the lights on in the next room, and then it was kind of hard for me to really confirm. It wasn't clear. It's still not clear everywhere, but it's a much bigger, lighter view, and I have perception of movement and shape and form where it was just blackness before.
Yeah. Yeah.
So, and it's so helpful just going to in the airport. You know, I know people are moving beside me instead of just bumping into everybody because I have no clue that there's anything beside me, and so that's extremely helpful. And then I also this time I got rid of my contact lenses, and I now see 2016 with no correction.
You had the contact lenses after your cataract surgery, right?
I did. So I had cataract surgery. I had severe myopia before my cataract surgery, and they corrected me to 2016 after my cataract surgery. But then after that, I had problems with opacification. I had problems with swelling of my macula, and all of that stress. I ended up having to wear contacts because I got astigmatism in my right eye. My left eye was corrected for reading. And my eyes weren't working together, and so I'd never had optimal vision anywhere. And so anyway, this time I was wearing contacts in both eyes for distance so that I would have the best chance to see. And I started noticing after a couple of days that I wasn't seeing well with the contacts. So I took one contact out, and that was better. And then after a couple more days, I took out the other contact and realized my vision is getting better, so these contacts are actually making my vision blurry. And then I noticed it. I didn't tell you at the time because I didn't want you to know I'd been wearing my contacts, so I wasn't supposed to be. But I could tell by looking at the eye chart. I'm seeing almost 20/20. And that's when I told you because I could tell it was getting so much better.
Oh, yeah.
And then it was 2016.
2016 without contact lenses.
Without contact lenses, and clearly 20. I mean, I think I missed one on the 2016 line.
Yeah, you see 20 letters out of 21 letters.
Right, and I feel like both my eyes are functioning together.
Oh, that's wonderful. You see, from our today's test, your visual field is 180 degrees, and your central vision is 2016. And how's your night vision then? Vision at night?
I think my vision at night is pretty good. It's definitely improved, and even my daughter could tell just walking with me. And my other children at home say that that's one of the big things that they can tell is how much better I see at night.
Yeah. So your vision today is better than 90% of the people walking on the street of Vancouver.
Well, my acuity is for sure.
Yeah.
My acuity is for sure. My peripheral distance. This time I noticed that on the right side, excuse me, it getting much clearer. And the left side is still not as clear as the right side. But I'm just so excited that it's there. There's something there where there hadn't been for so long.
Yeah. Congratulations.
Thank you.
You're welcome.